Welcome guys, welcome back. So what is the movement of this bone system in our body? You know what? The bone is actually moving any point of time. When you move a finger, when you move a little of your leg, everything involves connection of joints in the bones. And if your ligament is being properly made and your calcium deposit is really good, and you know what? Your bone facilitates a good amount of movement. If any tissue is damaged, you know what? You will hear sound when you move your bone and you will have a huge pain in joints. You can't even move because all your ligaments, all your tissues were completely torn off. Then people undergo surgeries for knee replacement, for hip replacement, for elbow replacement, shoulder replacement. All these things are joints, guys. There is something called structure of joints, which is like fibrous structure, which doesn't move, like a fixed one. There is something called cartilaginous, which is having a little movement, like let's say our neck, let's say our spine, which has a little some movement. There is something called synovial joint, which has a full movement, like our arms. See, it can rotate 360 degree, like our knee, it can rotate 360 degree. Simple, right? So these are all the simple movement, guys. And there is something called joints, which I would say movable and immovable. You can see the immovable joint is teeth attached to the gums, right? It's immovable, guys. Simple. Little movement, I would say amphiarthrosis, like the throat bone, like the rib cage. Simple. And full movement is something like knee, feet, arms. Because based on movement, it's divided into three types. So all these movements are facilitated by ligament tissues and calcium, guys. If you're not taking proper intake, everything will have a problem. Okay, so no need, guys. This is very complicated. I would say we have pivot points, we have ball joints, we have saddle points, we have hinge points. So all these things are actually functioning like a mechanical system. We know our latch, we know our door system, we know our windows in our house. Everything is ball socket pivoted, right? Same like our body system, bones, guys. If it is not provided with proper supplements and nutrition, you know what will happen? You will have a lot of bone related problems. That is why people after 30 to 40 age gets lots of issues. And particularly, you can move, you can rotate, you can elevate, you can depress, you can invert, you can do supination and pronation. All these things are possible only because of joints. If joints is not facilitated properly, obviously you can't move, guys. That's the basic principles behind joint. So how do you talk about ball and socket? See, movements in all the three planes. Can you see the left hand side picture, guys? This is a bone and this is a socket, and how this ball and socket is being made so that naturally our hip, our shoulder, our arms is being locked like a ball and socket so that it rotates easily. And you know what? After some point of time, like let's say 40 age or 50 age, people loses the ligament tear strength, and then doctors will come and put you surgery. They will come and put you implements. Can you see the right hand side picture? This is called acetabular component, where mechanically they will insert the steel parts inside your bone to facilitate the movement. See, can you see the right extreme picture? Two bones are joined by a metal part. That actually takes care of rotation. That actually takes care of pivoting into three direction to multi-axial rotation. Simple, guys. If you don't take care, all these things happens. But if you take care properly, you are healthy, guys. See, this is how the head of the femur and bones are joined. It's same like a mechanical ball and socket joint, guys. Nothing complicated. So from the bones, this is how muscles are attached. See how the muscles, myofibrils and muscle fibers are there. I see how it is attached to the bone. This is how our entire structure is formed, guys. It's not like we only have bone. It's not like we only have muscles. We have an intermix of that. All the muscles have been put on top of the bone so that the bone gets the full structure to make it look like a skeletal thing. Wonderful, right? There is something called bone marrow. Okay, so we will learn about bone marrow in the coming video, guys. Very interesting part of the bone, which we will see in the coming video.